Hey there! Before you're about to dive into one of the episodes for our Maternal Mental Health series, make sure that you have subscribed to our podcast on Spotify, Apple Podcasts, or wherever you get your podcasts. If you like this episode, we would appreciate if you spread the word and recommend or even forward this episode or the whole podcast in general to another parent or to anyone who you think should be listening to this. If you find yourself asking how you can support us, the easiest way to do this is to give us a follow on Instagram at Damn Parenting Podcast and to rate us with 5 stars on the platform that you're listening to this. We hope you know you're not alone on this parenting journey and you enjoy the following episode. Let's get started.
Hi everyone and welcome back to Damn Parenting, your English-speaking parenting podcast from Amsterdam. And you know us by now. We are your hosts, Maren and
Eva.
And with us today is the lovely Chandelle. Hi Chandelle.
Hello, ladies.
So good to have you back. And for the attentive listener, you already know this voice because we already had an episode with Chandelle in our first initial drop of episodes when we started this podcast. And Chandelle was so kind to shed a light on the whole topic of midwifery and how the midwife work here in the Netherlands. And now we have her back for our Maternal Mental Health Month. And we will talk with Chandelle about the immediate postpartum period, the first 6 weeks after you give birth, and what are the things to look out for during this period. So if you are pregnant right now, this can be an episode where you can plan ahead for this time. Or if you're already in it, if you have given birth a couple weeks or days ago and you're in these 6 weeks postpartum, then this is an episode for you to maybe check in with yourself and pick up some questions that you might be addressing with your midwife and anything that's in the unclear. So Chandelle, what can we expect from these 6 weeks when we have given birth? We've had the first initial visits after the first couple of days from the midwife. And then some of us feel like there's this big gap and then where we don't see our midwife. And then after 6 weeks, we're kind of like, all right, everything's fine. See you. Goodbye. Maybe meet you another time for a next baby. But some of us, of course, go through very intense mood swings, hormonal change, breastfeeding, all that kind of stuff. So is there anything that we can see the midwife earlier for? Are there any questions that we should be asking or the midwife or ourselves to guide a little smoother through these 6 weeks?
Yes. Well, first off, it is a very, of course, intense, like you said, period after labor. You went through labor, you have the physical recovery, of course, the breastfeeding challenges, adjusting to parenthood if you're a first-time parent as well. So it is quite intense. So especially what you see with about 50 to 80% of all women do experience a certain degree of the baby blues. And they can last the first 2 weeks. Often they are the heaviest at day 4, day 5. That is often the day, it's just the most shittiest day of the entire week. Huh? You've got the engorgement coming in. You've got the stitches might hurt really bad that day. Then you've got the baby might have lost weight to go on that topic as well. And then you've got like a certain drop of adrenaline as well. So you're on an adrenaline high after labor. And that drops around day 4, day 5. And then so you've got the hormonal fluctuations as well. So often day 4, day 5 is horrible. And then it will start to pick up. But it can last around 2 weeks, the baby blues. And of course, the midwife is very attentive in those first 2 weeks. Let's say the first 8 to 10 days, we're there quite regularly. Of course, you've got the kraamzorg the first 8 to 10 days as well. And this is really the part where we, of course, monitor the physical aspect, but I think we will also monitor how well you're sleeping and how bad are the baby blues if I really focus on the psychological aspects. And especially the sleeping part, because a real bad sleep deprivation can absolutely trigger, for example, psychosis. So this is something that we are quite aware of. And especially if women call us in the first few days crying, having not slept or having maybe slept for like 2 hours for the first 4 days, that is, no one can survive that, of course. So that's when we're very on top of things and we would make sure to give you sleep medication, for example, even though you're breastfeeding or anything else, just to make sure that we sort of prevent that psychosis from happening. So that is really the first week that we focus on, or that we're aware of that happening as well. We've got some context with, for example, a crisis team as well, in case some women do happen to go into a psychosis. And knock on wood, I've never had it happen once, psychosis. I'm really glad with that. But of course, I do see the women where I'm like, maybe we need to do something, and we need to set up a plan, a postpartum plan. How are we going to do the feedings in the night, for example, medication. The tricky thing is, however, is that we as midwives are not allowed to prescribe any medication. So we're only prescribed or only allowed to prescribe iron tablets, oxytocin, lidocaine, if we need to do the stitching, for example, and contraception. We're not allowed to prescribe any sleep medication or anything else. So we need help from the GP in that case. And they are allowed to, of course, prescribe you medication. After that week, when we close off care not completely. We don't actively contact you anymore, but you're more than welcome to contact us for anything that is still pregnancy or birth related or postpartum related. So that could be ranging from stitches to breastfeeding problems, but also really postpartum depression symptoms, for example. We can have conversations in that time. So you can definitely make an appointment, or we come around to your place, for example, to really see, is this maybe still baby blues? Is this very typical just postpartum period adjustments, for example? Or do we notice some symptoms that might lead you to postpartum depression? In that case, we also have to refer you back to the GP, and the GP will need to go on to refer you to other specialists. And that's the difficult thing, that we are able to refer you to a gynecologist, for example. We are allowed to refer you to, or refer the baby to, the pediatrician, but we're not allowed to refer you to the psychologist or a psychiatrist, which is just Dutch annoying administrative things. Also, for example, with the poepoli, it needs to happen via the GP. I cannot refer you to the poepoli, for example, which makes it a bit difficult that we're so dependent on the GP, whereas we, of course, are more the specialist in terms of everything pregnancy, birth related or postpartum related. And often the 6 weeks checkup is also a bit of a physical check, but we also really focus on how have the 6 weeks been? How do you reflect back on labor, for example, on pregnancy? How are you adjusting to parenthood? But I have to admit, not all midwives are as thorough as other midwives. So I tend to focus more on the psychological, the social bit. And then at the end of the 30 minutes, I'm like, oh yeah, and how is urinary continence going for you? Is it going good? So that really depends on the midwife.
So in this first 6 weeks, the first contact, if we feel something's off, should be more the midwife. And then the midwife would take a closer look on things and then advise us, you should get in contact with your GP. We should get in contact with this person, and not the other way around. Go to the GP first, but really your midwife should be your first point of contact, is what I'm hearing.
It could be. It doesn't necessarily have to be. Often people after the 9 months feel much closer to us as midwives because of this special bond, this special intimate time that we've shared with you. So they feel more comfortable reaching out to us than to a GP who they might have seen 2-3 times in their lives, because they just don't happen to have things that they need to see the GP for. So they feel less comfortable reaching out to the GP as a first thing. So then it's definitely okay if you reach out to us. But there are some women who have a good relationship with our GP, and then it would be maybe quicker to go to the GP because they can refer you quite soon or quite quickly. Whereas if you would go to us, then you have the whole story to tell us. Then you have to retell the story to your GP and then get referred or get medication, for example.
And you mentioned the word baby blues and then postpartum depression. Can you give us a little differentiation where we as mothers can maybe ask ourselves, all right, does this fall a little more into the baby blues? I'm like on the, putting this in quotation, normal scope of things, or is this something already where it's more severe and I should be really getting in touch with someone?
So if you would look at the definition of a depression, just a regular depression, you have to have at least 5 certain symptoms of a whole list of symptoms every day for at least 2 weeks. If you would look at baby blues, it would be within the first 2 weeks. So it is on the highest level at day 4, day 5, but you would see it would subside after 2 weeks. So day 10, day 11, maybe day 14. Never had it happen that long, but it could be up to 2 weeks. But everything that's still present after those 2 weeks, then you would really define it classically as a depression. So anything lasting more than 2 weeks, then you would really say, okay, maybe I do need some help, especially if it's lasting up to a month, for example, after delivery. So a postpartum depression is really diagnosed within the first month, 6 weeks postpartum.
Is that the same for PPA, postpartum anxiety?
Yes, although you do have some cases where it really occurs after, for example, stopping breastfeeding. But then you have, it's a very new term, but post-weaning depression or post-weaning anxiety. So it could happen after a few months, but then it would really be linked to the cessation of breastfeeding. But just regular postpartum depression or anxiety within the first 6 weeks.
Could you give us a couple of the symptoms that postpartum depression would actually look like?
Yeah, so just overall moodiness every day, not feeling happy or not feeling joy in everyday activities, not wanting to go outside, for example, or doing your regular hobbies. Sometimes suicidal thoughts as well, or thoughts of harming yourself, automutilation, of course, losing appetite, irritability as well, to list a few.
Does it always have to come with I'm coming back to the point where I don't feel connection with my baby? Is this also a driving big factor, or can this be one of the symptoms and then we have this is present and then we have all of this other on top? Or I don't have anything problematic with the relationship with my baby. I love this baby so much and I don't have any issue there, but I have all this other stuff. Or how is this? Because I think this is sometimes where people then feel, oh, I don't feel connected to my baby equals I have depression and I am clinical and this is like all bad. I think I'm hearing a little is like this is not necessarily linked to each other.
No, definitely not. So it can be a factor, but it's not necessarily a sign of a depression. And, you know, the bonding feelings, not every woman gives birth to her baby and feels automatically connected to that baby, but can really feel joy when she's going outside and having a piece of cake and having, for example, her libido, for example, increases again, because that can also be a sign of depression, a low libido. So that woman doesn't have depression, but the feelings or the motherhood feelings still need to grow, or she still needs to grow into a role as a mother, which is very normal. You have to learn a new tiny human being. You need to get to know baby, and then slowly it will grow. So it's also, and that's why there's such a taboo as well on the topic, because people often feel, oh, I don't feel connected, so I've got a depression, and they feel very ashamed of it as well. Whereas the postpartum depression is really depressive symptoms, like a normal depression, only it occurs somewhere around that period of the labor. That's why it's called a postpartum depression, but not necessarily because you don't feel a connection to your baby. So you can still be very in love with your baby, but just don't have any need for anything else, or just have, well, the depressive symptoms.
I think I remember my verloskundige actually said it to me in the first few visits. She's like, bonding doesn't happen immediately. It can take up to 6 months.
Yeah.
Is that a standard?
Well, there are some women that they automatically connect to babies, but not for all women. So I wouldn't say the standard is 6 months, but it's normal if it needs to grow. Definitely. Yeah.
Is it something you would say to your clients as well?
I wouldn't put the 6 months label on it.
Okay. Yeah, because that was the thing I found strange in my appointment when she said it. I thought, oh, okay, I've got a marker.
Yeah, exactly. That makes it a bit tricky for me. I would leave it like is and just say, you know, it needs to grow. Yeah. For some, it's there after 3 months. For some, it's there after a year. But 6 months, I don't really know where that would come from.
And you've said that the psychosis, luckily, is something that doesn't occur very often and you have never come across it personally. However, it is there and some women do experience it, and it can lead to very, very, very bad outcomes, what are the symptoms that we would be looking out for when we talk about the psychosis, and how does it differentiate from the depression, and can also the depression be there first and then lead into the psychosis, or what is really like the wall between those two?
Yeah, it could lead into it, but what would differentiate a depression with psychosis is that you would really have the hallucinations, for example, or just aware of your surroundings, talking to people who aren't there, for example, seeing things that aren't there. Often you see, or there are some cases of women being very protective of their baby, but then doing strange things to their baby, for example, or to themselves. Yeah, it's a very dangerous place to be at. And definitely depression can lead to the psychosis, but not per definition.
Yeah, when you were talking there, so two things that stuck out to me so much was, first of all, when you said 80% of, or up to 80% of women experience this, I had no idea how common it is going through postpartum depression or baby blues, that it's really...
Baby blues, though. So
yeah, baby blues, yeah.
And then 1 in 7 women experience a postpartum depression.
Yeah, so those numbers are pretty high, I think, considering that it's not something that a pregnant woman would prepare for necessarily, or I hear pregnant women talk about so much. And then one thing that you also mentioned, and this is, I guess, then something to look out for everyone who is pregnant and preparing for this period, really sit down with your midwife and talk about the first couple of days, because exactly what you had said, now I'm going back to my own experience, happened on day 4. It was a total shit show. Like, I was in shambles, and because my daughter had lost a lot of weight, or more than she should have, she was still fine, but we were in this whole cycle of she had lost too much weight, she was too tired to eat, and that was like the whole loop we were in. And that just crushed down on me. And I thought, my baby's gonna die. She's not gonna be nourished. Like, this whole thing was really on day 4. She was born on a Saturday, and that was on a Tuesday. I remember the Kramzog at the end of the day writing into the book, "You are a good mom. You are a good mom. It's not feeling good today, but you are doing fine." And if I would have known or heard about this day, I could have been a little more, not relaxed, but a little more eased, or not go into this full drama cycle. Or also my partner could have said, all right, remember, this is day 4. This is what is happening now with the hormones, with the adrenaline, with all that. So I guess this is something, if your midwife doesn't address this with you, then this is something to really talk about. Okay, I've heard this. How can we prepare for this? How can we make this a little easier on these couple critical days that are coming?
Yeah. And it's very difficult because we have courses on breastfeeding. We've got courses on birth. Most definitely, everyone prepares for birth. Huh? That's like the climax. And then there's just a baby, and then it's fine. You've gone through the most, but then it's just a start, birth and labor. And then you go through a whole different period. And there are some courses now starting to come out there called the 4th trimester, for example, or something along the lines of 4th trimester, preparing you for that postpartum period. And people are getting more and more aware of all the things that they could expect in that 4th trimester. But often what I notice is that people, if I would like to, for example, address the topic, then it doesn't land, because they are more focused on that birth and labor and how I'm going to survive that period. So even if I do address the topic or address the days, it doesn't always land that well, or at all, women. And how you would address that, or how you would tackle that, I don't know. But I think creating that awareness, and people sharing it on their Instagram, or influencers talking about the 4th trimester, I do think that helps, because that's why the courses have been developed more and more.
Yeah, what I also tend to look back to, or like tend to notice, is that we as women, I think birth just puts a whole other marker of tolerance on us, because we, at least for me, this was like the most crazy thing I've gone through in my whole life. And then this kind of sets the bar. And then you're like, well, it's not as bad as birth, right? It's not. So everything that in a pre-birth scenario would raise all your flags is now, it's nothing. It's nothing compared to birth. So we're much more, or I at least was much more tolerant on physical pain, but also psychological pain. Cause I was like, I have suffered like for over 20 hours. So what is this mood swing now? So I think this is something that I've noticed with me is then something that an outside person would see easier than I myself, or I would then talk it down like, oh, what is this compared to this big birth or this big thing? But it is still up off the norm. So it should be addressed at a certain stage.
Because it's also very tricky if you really focus on labor as being the most
challenging part, I guess.
Exactly. I wanted to have a big word, but challenging, I would say. And then, the postpartum period is very challenging as well with sleep deprivation, but also so many things happening on a hormonal level as well, on a physical level, that I've had lots of women as well being so shocked at how they feel postpartum that birth sort of vagues out. They're like, birth was okay, that ended, but this like what I'm gonna be experiencing for a year or for 2 years? Is this what my life is gonna be like? Whatever did I do? Wish I didn't go for a baby. I've had that remark quite often. Why did I choose to get pregnant? And if I knew the sleep deprivation that I would be in, I would have never gone for this. And it's I think only when you are really experiencing it, you really know what it is like, because nowhere in your imagination can you reach that level of sleep deprivation. Huh?
Just wanted to ask you, so when we get to the 6-week mark and we're having basically our final visit, I guess, with our midwife in-house, are there questions we should prepare for or we should ask ourselves before we meet the midwife? Are there things we should be putting forward to them? It's something that we should really take note of.
So there are some basic questions that we ask as midwives, mostly relating to the physical aspect. So are you still breastfeeding, or have you stopped breastfeeding? Are you still experiencing blood loss, for example? How's your incontinence? How has your perineum healed? And then we also address, of course, the contraception. So we ask about, have you already had intercourse? Yes or no? How was it? Have you thought about contraception? So those are like the 5 medical things that we really need to address with you. And then we often reflect back on pregnancy, birth, postpartum period. And this is really open because it's an open question. How have you experienced it? Of course, also, that's part of the postpartum checkup. I don't know if all midwives do it, but it should be part of the checkup is how have you experienced our care? Are there some things that we should have done differently, for example? Some things that we should improve on? At least I know that at our practice, we always ask the question to see if there are some things. But with that open question, how do you reflect back on pregnancy, birth, postpartum? This is really your time to address certain things. And there are some answers or some women that answer just, oh yeah, it was fine. Yeah, pregnancy was tough, but it's okay. If you have a midwife that doesn't pick up on certain body language or on certain phrases or how you would say certain things, if you don't have a midwife that notices that certain nuances, then it's a lost moment for you to maybe address some psychological things that are happening with you. That's what I would say about it. I think I may be one of the midwives that could pick up on certain things. So I would really poke a little bit more and see what I can get out. But if you're really close, of course, and at a certain point, I'm like, okay, then it should be fine. See you next pregnancy, hopefully. And it's done. But I think that is really your time to grab our attention. But it's not specifically that we ask certain questions regarding your psychological health. Maybe there are some midwives, but not necessarily.
Thank you so much for joining us and actually for launching off our Maternal Mental Health series for the month of May. You have been an asset to us and an asset to more than 150 women here who've listened to your episode. Close to 200, actually, to be honest. So, I think there's a lot of people who are actually I think they took a step back after listening to your episode to kind of be a little bit more humble, maybe, to kind of be a bit more in awe as well of what you actually go through in the process that a midwife must go through for their training, how serious it's taken here, how different it is from our home countries as well. So we greatly appreciate your time that you spent with us, your insights and knowledge. This episode has been very crucial to kickstart our Maternal Mental Health series, because it obviously starts with you guys, because you're with us through our pregnancy.
Yes. Yeah. Well, I was happy to join, and so happy that I was allowed back on the.
Anytime. And your name has come up in other interviews as well. Everyone is like, oh yeah, you should talk to Chandelle. We already did, and we will be in the future. So
Really?
thank you so much, Chandelle, and we'll have you back.
Yes. Looking forward to it. Thank you.
Thank you.